David, we recently passed the mark for the first 100 days of the Biden-Harris administration. What's your initial sort of reaction to the administration and how it's starting?
Well, I think it's probably delivered fairly well on what it wanted to deliver. I'm pretty sure you would agree with me that the new administration came in with an understanding that first and foremost it had to deal with COVID. Second and foremost, it had to deal with COVID. Third and foremost, it had to deal with COVID. And nothing else really mattered if we couldn't get the pandemic under control. Wouldn't you agree?
Yeah, I would. I mean, I think we should talk a little bit about where we are now with the response to the COVID-19 pandemic, both in the United States and abroad. And I think the other point I would make, which is I think the administration felt pretty strongly about what I'll call a tonal shift, that they very much wanted to change the tone of the federal government and the president, and really wanted it to be about, more around policy actions than sort of individual comments on sort of specific events, et cetera. And so that's been interesting just to sort of see how that shift has occurred over the last couple of months.
It has. It's very interesting to watch the daily press conference that's at the White House, and Jen Psaki, the press secretary at the White House, just really in a very different way, just not taking the bait and going into the back and forth between different sides and between those people who do not support Biden. It's just been a very interesting way in which to go. And you're right, they really decided to make their statements through policy. COVID being the number one thing, getting to the numbers of individuals who at least had one shot has been kind of amazing when you really think about where we were 3 or 4 months ago. And it was just hard to imagine that we would be going into May, or we'd be in May, and that we really would actually be this far along. And then they really helped us out. And I would say that they did help us out as we ASN pushed, and members of the kidney community pushed, because everyone did, to get a federal allocation of the vaccine directly to dialysis patients in dialysis facilities, which I think was a really big deal. But you're right. Now we have to deal with kind of where are we in that fight and where are we in it globally, because we're not isolated. And you and I just recently worked on some of that with the rest of the leadership of ASN. Why don't you just kind of introduce that subject?
Yeah, I think it's interesting because one thing the administration's done, and this gets to this tonal shift, is they've set achievable goals, and then if they surpass those goals, say with the number or percentage of the population vaccinated, they kind of move the goals again. And so there's constantly this sense of, it's probably the policymaking equivalent of a participation trophy, in the sense that you're constantly sort of hitting these milestones, and so there's a sense of momentum that's real in terms of making progress, but also probably emphasized in a slightly different way than the alternative, which is to set a very ambitious goal that you may not set, and then you're constantly kind of having that discussion. So I think just from a communications perspective, that's been really interesting. In terms of your question about the communication related to the broader strategy, So what we've done as an organization is contacted the administration and really said, okay, given the progress you've made here in the United States, it's really time to be a leader more globally. We provided data that are well known and heartbreaking about what's happening in other parts of the world. And just the level of disease burden, the number of cases, the number of deaths, the lack of vaccine and supplies, and just terrible situations throughout the world. And, this concern that if, you cannot address a global pandemic in one place, it needs to be a worldwide strategy. And so, after making that case and explaining sort of why we think it's so important, we had a couple of very specific asks and at the highest level possible. The first was, really encouraging the administration to work with the World Health Organization and other international organizations to control the spread of the virus through public health measures. And, again, we just have to keep going back to, we know what works and emphasizing that, doing everything possible to make sure that gets communicated. The second was identifying and providing supplies urgently to those countries that have a lot of sick people. And, oxygen seems to be a real challenge. So what can we do, as the United States to help there? The third was then coordinating with other countries around a global solution to the vaccine access and really trying to get vaccines to as many places as possible. And it's interesting because I think the model of how the kidney community came together and how the dialysis organizations worked with the patient organizations, with ASN, with the government to really try to allocate specific vaccines to the dialysis population and staff. That is a model for what we can do when we work together, and what role does the United States have in terms of sort of global vaccine distribution, and let's accelerate that as quickly as possible. We then sort of shifted a little bit in terms of our fourth request to the administration was really focusing on the kidney community. I think the good news is, given their response to what we'd asked related to the dialysis population here, is to think, okay, what can we do with people with kidney diseases, with kidney failure, with kidney transplants at a global level? And then finally, there were issues around sort of trade protections, and the administration has, after we had sent the letter, and, I think these were obviously on separate courses, but this issue around making sure that we handle those issues as well. And there's a lot of, interesting implications that we can get into today or at a future date. So those were the five asks, and I've been really impressed with their receptivity to those. And, my hope is there's more we can continue to do at a global level so that we can, put this pandemic behind us.
Absolutely. We were looking at the hotspots regionally. We realized that India was very, very much on the minds of many of our listeners, and it's very important. But the catch was the other regions of the globe. The numbers just are making it very clear. The United States cannot protect its citizens if we're not actually bringing the rest of the world along with us in the vaccination effort. And we'll just be constantly developing new variants that we're always trying to stay 2 steps ahead of. So it's really important that this be done. And I know that probably our listeners they're 100% behind this. But it really is kind of a moment to say this can't stop at our borders. Wouldn't you agree?
I would, and I think it provides a transition in terms of, as we think about the first 100 days, one of the challenges the administration has had is been the southern border of the United States and thinking about immigration policy. And obviously the Vice President Harris has been assigned responsibility for trying to think creatively about ways to address a lot of the challenges at the border. I'm just sort of curious as you've been looking at what's been going well, and you mentioned the COVID-19 response. What are some other examples of things that have been going well, and then examples of some challenges like the situation at the border?
Well, the situation at the border has been very tragic and has definitely, I think, kind of taken the new administration a bit off message and actually thrown them a bit of a curveball to deal with. And I hope that does get resolved sooner rather than later. I think that probably, the things that you can look at is, they did manage to get the almost $2 trillion package for COVID relief done in the first 100 days. They did use the reconciliation process, as we both know and have talked about before. And they are discussing and trying to find agreement on an infrastructure package, which will also be an interesting to watch situation, because the administration has really defined infrastructure in a much broader way than I think the more traditional view of just bridges and roads. So I think that's been really important. They've gotten their Secretary of HHS, in place. We have Andrea Palm, who's been confirmed to be Deputy Secretary of HHS. We have Dr. Rachel Levine, who's been Deputy Secretary for Health, confirmed. We have Liz Fowler in place at CMMI, the Innovation Center for CMS. which we'll get to in a minute because we're going to talk about a little bit about where the models stand in this new administration as we go forward. So they've got a lot of different pieces put there, and they have clearly placed a marker on every aspect of the federal government, but it's going to be a big lift in HHS, which is to address equity, and for each agency to look at where there are barriers to the programs and the efforts that they have to various groups. And that's just really an important point. And I just have to give my compliments to Dr. Rachel Levine, who is the highest ranking transgender individual openly that's ever been appointed and confirmed by the Senate in the United States. And so I think that was a fantastic step forward in terms of equity.
Just to pick up on the issue of equity and to provide a concrete example. So one of the things ASN was asked to do was to comment on ways the Agency for Healthcare Research and Quality, which is the federal government's health services research arm, how that agency could do more to address issues around disparities and inequities, and specifically around how we assess kidney function and the current inclusion of race in that assessment. And as everyone knows, ASN and the National Kidney Foundation have been working together through a task force that will put forward recommendations soon on how to remove the sort of race coefficient, if you will, from that estimate. So that was part of the questions and sort of where ARC, as the agency is known, is going. That's just one example of where the administration is trying to focus on these issues.
Yeah, and ARC was very open-ended and really did open the door for discussion about how that factor occurs in lots of parts of medicine. But I do think that nephrology and how that works with the calculation of your kidney functions is one of the areas that people wanted to hear from us and to hear from other members of the kidney community about. And our listeners can go to the ASN website and read that comment letter that we did provide to ARC. And also included with that is just all in one place, but it's also on the record is the interim report that the NKF and ASN task force worked on that you just referenced, and several other pieces. So it has been an ongoing conversation that ASN has been trying to get his hands around, with the ASN really trying to lead the discussion about how we deal with these various factors, particularly in like calculation of kidney function.
So David, let's shift gears to the regulatory branch and really talk about some of the things that are happening at the Department of Health and Human Services and sort of the Centers for Medicare and Medicaid Services and just other aspects of sort of how the administration is trying to address issues either related to COVID-19 or the millions of Americans with kidney diseases and kidney failure.
Yeah, there's a lot to talk about there, and there are things that relate to kidney and things that relate more generally, but there are things that actually we've seen a lot of talk about what the items the administration has gone into and tried to reverse from the previous administration. There really hasn't been as much focus on things that are either ongoing or basically the administration has allowed to continue going and supported. And those things are very, very important in the kidney field. So, for example, there was a long, long battle for several years about a rule that would govern how the organ procurement organizations were really being evaluated. And so you could really judge whether they had improvement, they'd collected more organs, and how efficiently that system was working. And it was a very difficult conversation, and there were a lot of people who had concerns. ASN did support this move very strongly, and so it had gotten delayed, as many things that got delayed when the new administration took over, if they weren't in effect already, to give them a chance to review it. But one of the things that I think has gotten lost is the number of these that they have allowed to continue on. And so that one continues on, and it is now in effect. And so we are going to be looking at some very different, transparent, independent metrics for the organ procurement organizations, which means a lot, a whole lot to all of the kidney patients who would like to get a kidney transplant and are healthy enough to do so. And so the longer, as our listeners know, the longer they wait on dialysis, the less likely it is that they will be able to be healthy enough to get that transplant. And one of the areas to most increase the availability of organs is in deceased donation. And this is really what this is all about. It's really important. And I think the fact that the administration let it go forward also signals that the next step is probably they're going to be supportive as well, we hope, which is the next step is to go and work on some of these similar issues with the transplant centers. And that is equally important to make sure that we don't have disincentives in the way we have structured policies that don't produce the results that we need, which is more organs, more kidneys, and more transplants.
So one of the questions I've had about all the kind of transplant-related policy issues and sort of what's happening at the regulatory level, what's the time frame here? So just at it's sort of 30,000 feet, if you were to walk through the major changes that will occur and are likely to occur, just help us out in terms of when those you anticipate those taking place.
Well, on the OPOs, I think you could really see around 2023, 2024, you would probably start to see really some, you will see some changes right away, but I think you'll really begin to see the effects of a new evaluation system and a little bit more clarity in terms of what OPOs, how they're performing and what they're reporting. And they will now be reporting consistently the same metrics as different from what was happening before. When you really are going to see the rubber hit the road is around 2025 and 2026. And that's when you could start to see either some real big improvement, or you could also see some OPOs that have not improved being placed in a situation where they have a limited amount of time to improve or possibly lose the contract that they have. We're not lobbying for anyone to lose contracts. This is designed to be an opportunity for all of the OPOs to improve and us just to provide more organs for those patients out there who really desperately need them. So I think that's really what you'll really see. And there was a hearing last week on Capitol Hill, where they really did try to focus on the timeliness of this rule. And there are those who want to push it up and they want you to see those dates happen sooner. But the members of the Oversight Committee in the House clearly were not in the mood to talk about further delay. They were completely not in the mood to hear that. They wanted to know how fast the OPOs could move and what would be reasonable to be expected. And so that was just a really powerful hearing recently.
Well, David, I really appreciate your taking the time today, and I hope you continue to stay healthy and safe.
Same to you and your family, Todd.